Hello, my name is Constance, Colin. I work for the Standing Committee of European Doctors, which is an umbrella organization that represents national medical associations across Europe. I'd like to thank the forum for inviting me to present doctors' views here on mHealth. Well, basically, we did answer the public consultation of the Commission, and we were actually very happy to be consulted on this issue, which is, as we all know, a very current and a very accurate issue right now. We basically see two sides of the medal for mHealth. First, the potential benefits that can arise for patients and doctors and other healthcare professionals, and then also the risks that have to be taken into account. So in terms of benefits, we do see, basically I would summarize them in four main benefits. First, the quality of life and quality of care for patients. There is a potential increase in this quality of life and care for patients. Then the increase in patient empowerment, and this is something that doctors, when we consult them on this issue, they are very keen to put it forward, saying that it is mHealth do entail potential benefits in terms of patient empowerment, in terms of adherence to treatment protocols, and also in terms of healthy lifestyles. The fourth benefit is to enable better contacts between doctors and their patients, and this is especially true when patients live in remote areas. For doctors, it is very important to keep a face-to-face contact with their patients, but sometimes it is not possible because patients do live in remote areas. So while it is always important to keep the face-to-face consultation and the face-to-face contact with the patient, mHealth applications could enable to keep contact with the patients, always keeping in mind that there should be a face-to-face consultation. And the last benefit is the facilitation of the work of the medical professionals, of the doctors, to be able to access important patient data in the treatment context, so they can have a direct information about blood pressure of their patients. So this helps, again, the follow-up of the patients. Having said that about the potential benefits, we also have to keep in mind that there are potential risks about these mHealth applications that one needs to keep in mind. As for any new technology that arises, you always have to know the risks in order to better anticipate them and also to better mitigate them. So this is for us very important, and I think it has been very well developed in the different responses to the public consultations. I guess Celine will address this, and I was very happy to read that many stakeholders also know and acknowledge the fact that there are real risks that one has to take into account. So I think we can group them into five groups, these risks. First, and it has been addressed, the terminology issue and the legal gap. The fact that health applications theoretically would fall under the Medical Devices Directive and regulation after the revision is done. And then what happens with the well-being applications? They are not regulated. There is no regulatory framework for them, and this is something that has to be addressed. Also, within the medical devices field, if you have health applications that falls under the medical devices regulation, then it is still up to the manufacturer to decide whether or not he wants to apply for the certification of the application. And this also might be a problem because if the manufacturer decides not to apply, then there isn't. While the application would provide a medical service, then it would not fall under the medical devices regulation, and it would not be regulated. So that's also an issue to be addressed. The second group of risk that we identify is the issue of safety. Safety, reliability, and efficiency of the application, and it is somehow linked to the first group, is the legal gap. Certain applications do propose a diagnosis, while you can enter your symptoms in the application, and then you have a diagnosis. Again, this is linked to the regulatory framework. How are these applications regulated? It might very well be that the diagnosis is false, and then this becomes a matter of patient safety, and the patient is diagnosed too late by a doctor, and then there is no way back. So this is also something to be addressed. So there is a need for these applications to be better controlled. If the applications, the mHealth applications provide, for example, health information, don't provide a service by itself, but just health information, this information has to be assessed somehow. You can't provide health information without being sure that the information is correct. So here, I think it's important to ensure that there is a transparency mechanism whereby patients can be sure that the information is correct, so that the source of information is fully disclosed. The people know who is giving the information, which professional is giving this information through the medical application, through the application. It's like a scientific publication. You have to be transparent about the information that is given. So, and then there would need to be a sort of scientific assessment of this application, a sort of certification mechanism. I know that at national levels there are different certification mechanisms or controls or assessments that are done. I know, for example, in the Netherlands, the Doctors National Medical Association has a system which is called Arts and App, which means doctors and application, and there is a review board that assesses different applications based on different criteria and says whether or not these applications can be reliable. So that might be a system for wellness or well-being applications. Then the third point, and I'll go maybe a bit faster because I know we have to hurry up, is the liability and the liability issue and reimbursement schemes. If the liability of the doctor using such applications, such services, is not clearly regulated at national level, then he just won't use the application because he doesn't know what is his liability, so he just prefers refraining from it because there is no legal protection behind. So that's the first point. The second point is the reimbursement scheme that also varies from one country to another. Patients may just not want to use an application if they know that the application is not reimbursed. And then the fourth potential risk is the data protection. I think it was not. It has not been addressed so far, but I think it's an extremely important issue, the question of privacy, of confidentiality. Health data is considered sensitive data. So you have, in order to protect the patient's right to privacy and to confidentiality, you have to ensure that all the safeguards are in place to protect his privacy. We do think that there are two principles: the data minimization, which means that you have to use as less data as possible to provide the service and not aggregate more data that might simply not be useful for the service you are providing. And the second one is purpose limitation, so that the purpose which the data is collected is clearly defined, and you don't use the data for other purposes. We do think that the data should clearly, in terms of patient safety and protecting patients' rights, the data should not be shared with third parties in any conditions. And then finally, I think you have to provide full information to the patient or to the person using the application, full information about what the data will be used for, how it will be used for, who will access it, for which purpose. and what are also the governance structures that are in place to ensure that there are safeguards, and what are the safeguards in place. Finally, a last point, and I'll close with this, is the question of big data. I think we didn't address it so far, but I think it is a very crucial issue to address. There are clearly benefits entailed into the big data issue, but also there are very big risks about how the data is used for big data purposes. There are biobanks, and the multiple use of data do entail real challenges. I think, again, it is very important that the confidentiality of the patient's data is maintained, and that for multiple use of data, one should clearly have a framework that guarantees that the patient's data are protected. And this is a matter of trust both in the health applications, but also between the doctor and the patient. Thank you very much.
Thank you.